Scenario-based MCQ question number 1. A 60-year-old man suddenly develops crushing chest pain, sweating and breathlessness in the emergency room. The ECG shows ST segment elevation. What should the nurse do first? Your correct answer is option B. Obtain IV access and prepare emergency cardiac management. Rationally, early IV access enables life-saving medications and rapid intervention. Moving to the next question, question number 2. A 2-year-old child is choking on a toy and cannot cry or speak. What is the priority nursing action? Your correct answer is option B. Perform age-appropriate choking management. Rationally, severe airway obstruction requires immediate choking relief maneuvers. Moving to the next question, question number 3. 1 hour after delivery, a woman develops heavy vaginal bleeding. Her uterus feels soft and boggy. What should the nurse do first? Your correct option is option B. Massage the uterus. Rationally, a boggy uterus indicates uterine atony, the most common cause of postpartum hemorrhage. Moving to the next question, question number 4. A patient on oxygen suddenly becomes restless and SpO2 falls to 82%. What is the priority action? Your correct option is option B. Assess airway and oxygen delivery. Rationally, airway and breathing are always the first priority, like ABC approach. Moving to the next question, question number 5. The medication chart prescribes morphine 2 mg IV, but the medication order reads 10 mg IV. What should the nurse do? Your correct option is option B. Clarify the order before administration. Rationally, any medication discrepancy must be clarified before administration. Moving to the next question, question number 6. A patient with suspected pulmonary tuberculosis is admitted. Which isolation precaution is most appropriate? Your correct option is option D. Airborne precautions. Rationally, tuberculosis spreads through airborne droplet nuclei. Moving to the next question. Question number 7. A diabetic patient becomes sweaty, confused and shaky. Blood glucose is 48 mg per deciliter. What should the nurse do first? Your correct option is option B. Administer a rapid source of glucose. Rationally, immediate glucose replacement prevents severe neurological complications. Moving to the next question. Question number 8. A patient suddenly develops slurred speech and right side weakness. Symptoms started 30 minutes ago. What is the priority nursing action? Your correct answer is Option B. Activate the stroke emergency protocol. Rationally, early stroke management improves eligibility for time-sensitive treatment. Moving to the next question. Question number 9. A patient with extensive burns is brought to the emergency department. What is the nurse's first priority? Your correct option is option B. Assess and maintain airway. Rationally, airway compromise from inhalation injury can rapidly become life-threatening. Moving to the next question. Question number 10. Immediately after receiving an antibiotic injection, a patient develops lip swelling, wheezing, and difficulty breathing. What should the nurse do first? Your correct option is option B. Stop the drug and prepare emergency treatment for anaphylaxis. Moving to the next question. Question number 11. A 68-year-old patient suddenly becomes dizzy. Heart rate is 34 per minute. BP is 80 by 50 mmHg. What is the patient is conscious? Which drug should the nurse prepare first? Your correct option is option B. Rationally, atropine is the first line drug for symptomatic bradycardia. Moving to the next question. Question number 12. A patient suddenly develops generalized tonic-clonic seizures in the ward. What should the nurse do first? Your correct option is option C. Rationally, patient safety and airway protection are the immediate priorities. Moving to the next question. Question number 13. 10 minutes after starting a blood transfusion, the patient develops fever, chills, and back pain. What is the first nursing action? Your correct option is option B. Rationally, stop the transfusion immediately if a transfusion reaction is suspected. Moving to the next question. Question number 14. A patient's IV site becomes swollen, pale, and cool during fluid infusion. What is the most likely complication? Your correct option is option B. Rationally, cool, swollen, pale skin suggests IV infiltration. Moving to the next question. Question number 15. A patient with head trauma suddenly develops unequal pupils and decreased consciousness. What should the nurse do suspect? Your correct option is option B. Rationally, unequal pupils with reduced consciousness indicate raised intracranial pressure. Moving to the next question, question number 16. A newborn is not crying immediately after birth and has a heart rate of 90 beats per minute. What should the nurse do first? Your correct option is option B. Rationally, a heart rate below 100 beats per minute requires effective ventilation. Moving to the next question. Question number 17. A patient with kidney failure has serum potassium of 6.8 milliequivalent per liter and peaked T waves on ECG. Which medication should be prepared immediately to protect the heart? Your correct option is option A. Rationally, calcium gluconate stabilizes the cardiac membrane in hyperkalemia. So here the right answer is calcium gluconate. Moving to the next question. Question number 18. A patient receiving insulin suddenly becomes unconscious. Capillary blood glucose is 32 mg per deciliter. What should the nurse administer first? Your correct option is option B. Rationally, an unconscious hypoglycemic patient requires IV dextrose immediately. Moving to the next question. Question number 19. A patient with a chest tube accidentally pulls it out while turning in bed. What is the nurse's first action? Your correct option is option B. Rationally, an inclusive dressing prevents air entry and reduces the risk of pneumothorax. So here the right answer is option B. Moving to the last question, question number 20. A patient suddenly becomes pulseless and monitor shows ventricular fibrillation. Which medication should the nurse prepare during CPR? Your correct answer is option C. Rationally, epinephrine is the recommended vasopressor during cardiac arrest. So, अगर आप एम्स नॉर्सेट ESIC या नर्सिंग ऑफिसर एग्ज़ाम की प्रिपरेशन कर रहे हैं तो ये चैनल आपके लिए है। डेली MCQs और वन शॉट रिविजन के लिए सब्सक्राइब करें। थैंक यू फॉर वॉचिंग द वीडियो।